Hi, I'm Dr. Kiran Coelho, Senior Gynaecologist at Lilavati Hospital. Today I will talk about cervical cancer, early detection and prevention. Now we know that cervical cancer is the #1 killer of women in India today. In fact, the disease burden is 25% of the world's cases of cervical cancer are from India, and 26% of mortality is also from India. And it's very unfortunate because cervical cancer is very slow to progress. There are a lot of screening that can be done, and most women can be saved from cervical cancer with proper prevention and early detection. So for screening, it's so important that every woman, after she becomes sexually active, should have a pap smear test every year and HPV testing every 5 years. So in a pap smear, the cells from the cervix are taken and sent for a specialized stain, which tells us years before that cancer actually begins. It shows abnormal cells which we can treat and prevent cancer. So also we know that 99% of cervical cancers are due to the HPV high risk viruses like 16, 18, etc. So therefore, if we do a pap smear and test for these high-risk HPV viruses, we can then treat the patient and ensure that cancer does not occur later on. Early treatment is basically once we diagnose by doing colposcopy, that is with a telescope, look at the cervix and put acetic acid and find the areas which could be early precancerous stages. We can also do a cervical biopsy. And in prevention, the most important in cervical cancer is the only cancer where we have a vaccine against cancer. So we have a vaccine against HPV, and this is recommended for all girls above the age of 16 right up to the age of 40, where we can actually prevent the onset of infection of the HPV virus and also virus spot and growths, etc. And therefore prevention can be done with the vaccine, and also avoiding smoking, early intercourse, early marriage, frequent intercourse, multiple sex partners. Avoiding all these factors also are prevention of cervical cancer. Thank you.